Hi, everyone. Welcome back from the break. I'm Omnia El-Omrani. I'm a medical doctor from Egypt, and I'm the vice chair of the Global Climate and Health Alliance. I'm currently finishing my master's at the University of Oxford in public policy, and doing my fellowship at the World Bank with the climate and health theme. So joining you from DC. And more importantly, this session is very close to my heart because I helped establish with a group of incredible young climate leaders, a tribunal for intergenerational justice and climate change. So I'm very excited to be doing this session together with an incredible experts and panelists with us today. We've just come from a rich conversation on governance and how ultimately it is about multi-stakeholder engagement and power, how it's distributed, who holds it, and how it can be misused or under-leveraged. And this is where our session comes in, the legal and the policy frameworks through which we can organize power and influence for the health of the environment and the health of people, how power can be distributed, how accountability can be institutionalized, and rights can be advocated for with impact, with systematic change. And whether through policy mandates or strategic litigation, we have seen, especially in the last month with the International Court of Justice, the advisory opinion on climate change is a demonstration of how litigation, but also policy levers can mobilize communities and provide us with the opportunity and countries to hold accountable, to drive action for environmental health and human health. And it is now an opportunity to see how we can leverage the participation, the engagement, and the evidence by the health community to be part of the policy and the litigation processes that are being done, because we have been present, yet not enough. And this session is a way to see how the health community can be more integral and can work together with litigation and be part of national as well as global decision-making and legal processes. We are now at a critical time where there is an intersection between public health, human rights, and intergenerational justice. And as the health community, we have a responsibility to advocate for that intersection and to drive health as evidence, as the lever for action on climate change. And to help us explore that, we have three presentations that I'm personally extremely looking forward to, on how different legal and policy mechanisms can move us from commitment to implementation to accountability and from theory to impact. So to kick us off, the first example takes us to France, where a citizens' assembly model has brought climate policy closer to the public, as well as strengthened accountability for governments in that process. I'm delighted to welcome one of my personal idols and inspirations, Laurence Tubiana. She is not only the CEO of the European Climate Foundation, but also, as many of us know, the architect of the Paris Agreement, and she has been at the forefront of this work for many decades. Laurence, over to you.
Thank you very much, and for your very kind words. So I'm really pleased, and really, it's very nice from you. You know, do you hear me? Yes. What was really important, and of course, no need to make the links between health and climate change, because now it's more and more evident, and those data are there. And I think which was very important is that we saw the mechanism of climate assembly with 200 citizens, in a way chosen in a way where there was a representation of the French society, but of course totally haphazardly, so they were not engaged. In particular, we even eliminate in the choice the people who were militant from, in particular, environment association, for example. And what the first element we saw that giving information, and again, that's very sensitive on health, and I see the value there, giving information that is not just information that you read in the newspapers, but information that the citizens are meant to use And then it puts their ownership of information at the center of the exercise, and because expert brings their data and they ask and they change totally their mindset, which was for me a very, very important moment of my life, to see how 150 people precisely from every region of France, every type of economic background and studies and cultural background, finally took ownership on very difficult information on climate change. And I understand if you give that, the health information and the link, then they would give them agency to propose, not only to support policies designed by others, but to propose policies that they feel will be just and efficient. And you know, of course, a good surprise of the citizen assembly in France is that the proposal of the citizens were much ahead of whatever the French government was ready to go. So I think we have a more focused topic for a citizen assembly. Even this first one, it takes a lot of time. People gave a lot of energy and time. You know, they work, and the people who were there at the beginning were not the same people that were outside when they finished the exercise. They now are totally increase their awareness. They are active. Many went into local politics or work or talk in their companies or their family on the issues they learn, because then they were not a passive recipient of information, but the active owners and using this information as a tool for their participation in the society. The second element is we have, of course, climate and health can be very local, but they are very global problems as well. And I want to cite a nice story. One of the guy who entered in this conversation without any knowledge really on climate change beyond what is presented in the just mainstream media, he came saying, you know, in my life, my only objective in life was to have a car and a home. And then after that, he said, I am not the same person. He's now fighting for this notion of ecocide. And he said, I was outside of the world. I was not part of the world. And now I am in, and I am an active part, a citizen in the world. And even if you think that climate and health are very big issues, so that cannot be grasped by an individual or a citizen, that's not true. Because in reality, when you give the space and the thinking capacity and the information, people then transform that relation to even global problems. And I have many, many other examples that this is working well. So I would think that this will be a decisive moment. Unfortunately, the government has responded to some of the recommendations, not of all. More than it happens, I have to be really, that's true. They have responded. The elected people, the MPs, the representative were at the beginning very cautious now, and finally very positive. The striking observation was the anti-polarizing effect, because again, the discussion was from everywhere. And the pre-held prejudice were broken down totally, because the empathy for other challenge and problems was finally helping there. So when we want to build global public concern for climate health impacts that people maybe doesn't experience directly because they are experienced by other people more vulnerable in situation, and I saw that in the suburb of Paris, for example, or Strasbourg and others, you feel that now a movement that want to collect the pollution locally, the health issues in families that are not protected from that pollution, and now they are wanting to make the link with climate change. We see that there is a lived experience testimony that can really, really work. And finally, again, it's not set in stone. You have one model and you cannot do anything else. There is many emerging innovation that could be relevant in a health context, mixing personal experience and relevant expertise. We have seen, for example, at regional level, a citizen convention for climate and biodiversity in Burgundy. And that was really, really very efficient as well. And then that broadened the constituency of people that anyway, that will go for after, that will not disappear in the consciousness. And finally, I think we should think about, should we not, at the moment where public institutions are not trusted, even if the science is still challenged sometimes in an incredible way. We may need a more permanent deliberative structure to integrate the new information and to have some kind of decision-making process that puts the citizen at the core of the shaping of the decisions. And again, prioritizing the capacity to have time to collect and digest and receive information so as to use that information to make a good decision. And for example, Brussels and Milan, for example, now have permanent climate assemblies. It's probably too soon to know if this is really resilient and efficient. But I think the idea that it is a not one-off exercise, I think can be quite responsive to the changing nature of the climate and health crisis. And again, think about what would have been done if we could have shared experience, even in the difficult context of COVID, where people would not receive the instruction of isolation and public health instruction just as a top-down, but something they could operate themselves as well. I think we would have had an even better result. And so I'll close there. Very happy to have that because again, that resonates not only for local, national, European, and in my case, and of course globally. We will have a global assembly, citizen assembly for COP30 on climate, because I strongly really believe that we will not have any efficient policy if we don't have this citizen involvement, ownership, and agency. I don't see the leadership from government that will go as far as we need. And there is too many conflict and incumbents and, organized obstruction if we don't have the citizen really fighting for that and supporting that. So I will stop there.
Thank you. Thank you, Laurence. Yes, and we are looking forward to your feedback in the discussion as well. And it's so inspiring and powerful to see how meaningful citizen engagement has been so transformative in France, and also looking forward to see that at COP30. And one important thing you mentioned is also the idea of integrating lived experience and having a sense of co-ownership when designing policies. And that's what the health community can also be part of. So now from Citizens Assembly and engagement in France, we turn to the courts in Pakistan, where litigation has been used as a lever for climate accountability. Ahmad Rafay, he is the vice president of the Pakistan Environment Law Association, and he's going to share with us how legal victories translate, or sometimes are challenged for translation from action into the ground. Over to you, Rafay.
Thank you very much, Omnia. And I'm going to speak about one or two cases, Supreme Court cases in Pakistan that have sort of set the stage for institutional and legal policy implementation, but also discuss their sort of limitations as well. Given Pakistan's fractured politics and the fractured politics of many countries, it's difficult for democratic systems to deliver. And in the case of Pakistan, I'm quite proud to report, actually, that the Pakistani judiciary has led the charge, so to speak, on identifying and protecting environmental rights. As early as 1994, with the seminal decision of Sheila Zia versus Wabda, the Supreme Court of Pakistan reinterpreted the right to life, that's the fundamental right in the Pakistani constitution, to include the right to a clean and healthy environment, a precedent which has subsequently established environmental jurisprudence in Pakistan and gives lawyers like me a day job as well. Pakistan is also one of the first developing countries to have adopted a national climate policy in 2010. I need not go into how Pakistan is vulnerable to climate change. Every country is vulnerable to climate change. But this 2010 policy, its implementation was hampered by a landmark constitutional amendment in Pakistan about the same time in 2012, which decentralized powers and brought them closer to the people. But what that meant from a legal point of view is that subjects like the environment and many of the elements that climate adaptation and mitigation require in Pakistan were devolved to the provinces, Pakistan being a federation consisting of provinces. So while the policy was implemented, or rather adopted, its implementation was actually resting on the provinces to actually undertake. So it was in 2016 that a farmer and lawyer, Asghar Lagari, filed a petition in the Lahore High Court, which is the apex court of the province of Punjab in Pakistan, and sought a declaration on his fundamental rights in light of the climate crisis. The Lahore High Court observed, and I quote, that climate change is a defining challenge of our time and has led to dramatic alterations in our planet's climate system. For Pakistan, these climatic variations have primarily resulted in heavy floods and droughts, raising serious concerns regarding water and food security. This is a clarion call for the protection of fundamental rights of the citizens of Pakistan and can only be addressed by climate justice. This was one of the first judgments in the world that addressed climate justice in this way. And what the Lahore High Court did is it constituted a specialized commission. And this is a peculiarity in the environmental jurisprudence that Pakistan has involved, is that courts, sometimes when they're seized with environmental issues, will refer matters to specialist commissions who can bring subject speciality to the issue at hand to assist the judge in making a legal determination. Now, in the case of Asghar Lagari, the commission members included not just subject specialists, but also senior members of the government of Punjab, and they were tasked with sort of coming up with a climate framework for the province. And by 2018, the commission finalized its report. It identified, as a matter of fact, hundreds of projects that fell within Pakistan's adaptation and mitigation requirements and fast-tracked their implementation. And also, the government of Punjab, as a consequence thereof, started work on formulating its own provincial climate policy. In other words, devolving that power down and having real responsibility on climate governance come down to the people. However, in 2018, there was an election, a general election in Pakistan, and a new government came in with slightly differing priorities. Now, this didn't mean, of course, that work on climate change in Pakistan slowed to a halt. No, not at all. In 2017, in fact, the Pakistan Assembly passed the National Climate Change Act, which sought to address climate issues in Pakistan through a two-pronged policy implementation approach. One was to set up a council that would formulate policies, and one would be an authority that would implement those policies. However, the new government after 2018 updated Pakistan's climate policy to reflect its new commitments under its nationally determined contributions that it filed in 2021, but its approach to provincial policy making was very different. So in 2022, a civil society organization, the Public Interest Law Association of Pakistan, filed a case before the Supreme Court of Pakistan. And that's because in our law, we have the ability to go straight to the Supreme Court on a matter of public importance if it relates to fundamental rights. And here, the Public Interest Law Association of Pakistan sought an enforcement of the Climate Act and sort of to operationalize not just the council, but the authority as well, which had been defunct up until that point. And also a direction to the provinces to finalize their climate policies. The Supreme Court held that climate change was indeed a matter of grave and public importance tied to the fundamental rights of Pakistan and directed not just the operationalization of the climate authority, but also required the provinces, the provincial governments, to finalize their climate policies and submit them in court as evidence of compliance. And so I'm happy to report that as of August of last year, not only has the climate authority in Pakistan been operationalized, it's working, but all 4 provinces of Pakistan have their provincial climate policies. And in this light, not just the Lagari case, but the Public Interest Law Association case show how courts can be a very important lever in setting up the legal and institutional framework necessary to deal with climate change. However, a word of caution. I want to caution against too much optimism over here and refer actually to the issue of air pollution in Pakistan. Pakistan is beset with air pollution. And in fact, the University of Chicago Air Quality Life Index says that in my city of Lahore, residents expect to lose 7 years of life expectancy due to the air pollution here. I mean, it is a proper regional public health disaster, and it's not an abstract, because in the winter of 23-24, it was widely reported that over 500 children died in just 1 month of pneumonia. And now wintertime is when air pollution issues are exacerbated in North India and Pakistan. But this is the cost that we're now bearing of air pollution. And many air pollutants are also greenhouse gases. So it is a climate issue. Now, Pakistani politicians and the institutions responsible for environment have responded. There are several policies from 2016, 2018, 2022, and 24, all addressing air pollution in Punjab, the province that I live. And they all say the same thing. We have to improve our refineries so that the quality of our fuel is better. We have to move to renewable energies. We have to capture industrial emissions. We have to stop crop burning and a bunch of other things. But these things are not just expensive. They're time consuming and will take 5, 6, 7, 10, 12 years to be able to actually implement and see a difference. And so while the government of Punjab can glibly turn around in the face of an air pollution and indeed climate crisis and say, hey, we have a policy, the hard and expensive work of actually implementing it is what remains. And so the lessons of Asghar Laghari and the PILAB case are that the courts of law can be an important lever for implementing and establishing those institutions you need for climate change. But there needs to be accountability on the enforcement of those mechanisms, especially at a subnational level, if you want to make a dent about the climate crisis or public health emergencies like air pollution in Pakistan. And I want to thank you for your time, and of course, the National Academy of Medicine for bringing attention to this very important matter of public health and climate change.
Thank you. We want to thank you for that. And it's been so inspiring to hear about the unique devolution that what Pakistan has led with the Climate Act and how it translated into institutional reforms, but also recognize the challenge of translating policies that take so long to get created into implementation and action for people's health that they are continuing to suffer because of air pollution. So thank you, Rafay. And our final presentation brings us to the implementation, the institutional level, where policy levers and choices in healthcare are being translated into action within procurement, regulatory mandates. And I'm very excited and honored to present and welcome Dr. Nick Watts. He is the director of the Center for Sustainable Medicine at the National University of Singapore, but also one of the very people I've first met in the climate agenda, and it continues to inspire us every year. Nick, over to you.
Yeah, tough words to follow. Let's be quick. Hey, I've got a pretty simple premise. You hear a lot when people talk about low carbon healthcare systems. They throw around this phrase, scope 3. Oh yeah, scope 3 is very hard. Nonsense. I'm not honestly sure I believe it, or if I do, I think it's a little bit of a red herring. Scope 3, the GHG protocol scopes, they're just an accounting mechanism. They're just a way of allowing us to compare different organizations. So to the extent that for a healthcare system, there are some buildings, some fixed assets, some mobile assets, and the energy that moves them, some waste and water, and that's about 20% of your emissions. And then the other 80% is scope 3. So to the extent that when we are talking about our supply chain, we're kind of just talking about literally everything a healthcare system does, well, sure, it's hard, but that's because we're talking about too many things at once. So I'm going to talk quickly about 4 different ways, and they relate directly to each other, that I've seen big, ungodly organizations, hospitals, healthcare systems at a national level in the United Kingdom, yes, in Australia, in Singapore, in Canada, in the Philippines, the ways that I've seen them as purchasers use that lever to start to shift some of those broader emissions. 2 things are important here. Number 1, they're big. And number 2, they are more or less monopolies. No one else purchases from a pharmaceutical company. No one else purchases from a medical device company, except for healthcare systems. There's a unique advantage there. There are 4 things you do if you want to run at that problem. It's pretty simple. You get your governance right, you get your engagement right, you tackle the demand side, and you tackle the supply side. Number 1 on the governance, listen clearly, you need clarity on the overarching target. You need guardrails. You need to be able to say, today is 2025, and I can see 10 years into the future. And 10 years into the future, I want to be at this point. I have an interim emissions reduction milestone. And 25 years into the future, I don't know how I'm going to get there yet. But look at me seriously, I'm going to get there. You need to make sure that you have the legal framework to back that up. And then you need to have a series of milestones of things you are going to do, and frankly, things you are not going to do. So I've just said a bunch of words there, but translate that into what that looks like in the United Kingdom, into national university health system in Singapore. It looks like a net zero strategy that goes forward to 2045. It looks like a legal framework, legislative framework to give you the ability to do the things you want to do. And it looks like a supplier engagement roadmap. The governance is important. Number two, you got to make sure you engage. There are obviously a lot of actors here. Suppliers, of course, clinicians, of course, the purchasers. No one individual in a hospital or in a healthcare system is responsible for purchasing everything. In fact, even simple devices, even simple drugs are usually the purchasing decision of multiple actors. Usually a doctor's involved, usually a nurse is involved, usually a patient is involved, usually a pharmaceutical rep is involved, a couple of procurement people, a regulator at a national level. It's quite complex. And so starting that conversation with all of those actors, getting everyone used to each other, getting everyone used to saying the word pharmaceutical or scalpel and carbon, clearly important. Those are the first two things. The third thing, and this is where it gets a little bit sharper, is on the demand and then the supply side of things. On the demand side of things, there are clearly ways that purchasers can engage. We can look at incentives to try to shift some of the prescribing habits that we have from our asthma nurses, from our anesthetists. We can look at outright bans. We can say as a healthcare system, we no longer want to purchase some of those particularly high carbon things. And it doesn't have to be complex. It can just be plastic cutlery. Just getting going on something like that, honestly, probably the best way to start. We can look at enabling some of those demand side interventions. Often one of the big things that stops our surgical suites from decarbonizing is, and stops them from becoming a little bit more circular, is they lack some of either the infrastructure or the business know-how to be able to engage in some of those reprocessing contracts. The second you start to show people what that looks like, you show them it saves a little bit of money, they grab hold of it and run with it. Incentives, direct prohibitions, enabling infrastructure, and finally, contracts. There's a really simple example that we've seen in the Philippines. Yes, of course, the healthcare system doesn't own 100% of the vehicles that are driving patients around the country, but it looked around the world at who was doing good things on this, and it found a couple of examples, and it said, in the contracts we're going to sign with our non-emergency patient transport systems, we're going to request that 10% of the vehicles be fully electric in 2025. Go forward a couple of years, and we're telling you already we're going to expect it to be 20%. Now, we're running ahead of what the national fleet is doing, but that's okay because these are efficient transport suppliers. They have an interest, and they're often pretty good at making sure that they are running a cheap and tight operation. Yeah, the governance side of things, that engagement is so important, clear, constant communication, demand side interventions that run across every single category of emissions that you want to tackle. And then finally, it's a little bit of a sledgehammer, but really all it is just sort of gentle pressure moving forward, is the supply side interventions. Here, let's go to, again, what I'm familiar with, at least in the United Kingdom, a supplier roadmap. I'll break down the politics a little bit of what is in that roadmap. Number one, it starts simple. It says to big companies, you have a contract with the NHS over £5 million a year, so you are already a big company if you're doing this. We just want to know a little bit about your carbon footprint at an organizational level. Scope 1 and 2, that's fine. Just enough to start that conversation. In fact, so simple that honestly no one should be able to in 2025 say no to that. Then you start to slowly introduce weightings into tenders. In the NHS, it was 10%. In Singapore, 20%. The point isn't to change the outcome of a tender. The point is to start a conversation between a medical device rep, a pharmaceutical rep, and a clinician and someone in the procurement team. Just to start that conversation around, well, what would it look like if we tried to run a slightly lower carbon version of product X? Slowly you expand out to include not just contracts over £5 million, not just companies there, but slowly everyone. At every moment, you make sure you have exemptions for the little guys, exemptions for small, medium-sized enterprises, exemptions for areas where you're particularly worried about the vulnerability of a supply chain. Engage with this in a pretty common sense way. You expand who you're engaging with, and you start to expand as well with what you're asking. Not just scope 1 and 2 anymore. Now 1, 2, 3. Don't worry, it doesn't have to be perfect. No one's footprint is perfect. But we want to know that you're trying. And over time, introduce third-party verification services, SBTI. As you do that, provide support to those small and medium-sized enterprises, innovation grants, smaller contracts for people that can deliver a lower carbon version of the product that you're after. Be clear as well, and I think this is the final point and the most important point, be clear that you are serious. By far the most serious commitment I've seen there, and it says it again and again and again, and I haven't seen it stop saying that. Within the decade, the NHS will no longer purchase from anyone that does not meet or exceed its commitments on net zero. That's kind of cool. What is really cool is that I've now seen 5 other countries start to explore what that looks like for them. 2 other countries start to say the same thing. When you get that governance, the engagement, the demand side and the supply side interventions all wrapped up together, and it's not just one country, it's 10, 20, 50, that's when you start to make this stuff a little bit more inevitable. And that's when you start to, I think, see the real power of purchases as a lever for change.
Thank you. Nick, that was super clear. We now have 4 different priority areas, but as you said, hoping to see many more countries do the same, but definitely inspired by the work you've led both in the UK and in Singapore. So before we move into the panel discussion, I now want to invite Professor Joyeeta Gupta to join us and offer her brief reflections on some of the key areas and cross-cutting themes. And Joyeeta, I know through your work on the Global Constitution Project, you've been grappling with the same discussions around policy, around litigation, accountability, translation from policy to implementation. And from these presentations, what are the lessons and the gaps that you see, but also the opportunities that would inform the kind of legal and policy architecture that the Commission should consider?
Thank you so much. I just want to clarify that this is the slide that you received from me. Is that correct?
Yeah, it's on, where it's displayed now.
All right. Okay. So basically what I would like to do is to start with saying I really enjoyed listening to all your success stories. And most importantly, Laurence brought up the issue of civic space, using the civic space through citizens' assemblies and through deliberative spaces to encourage the public to know what is happening and to mobilize them into agents of change. And then they become much more excited about these issues and come up with new ideas which go beyond what the government wants to do. Now, this is extremely important, and I love the story. I just wanted to say a little bit about the fact that right now, in many parts of the world, the civic space is shrinking. And people who speak out on climate issues are also being arrested and being punished for this. So on the one hand, it's wonderful to see the expansion of civic space in some areas. And on the other hand, we need to be aware this is a problem. I'd like to put this story that we heard just now from Laurence within the framework of a sort of a climate system or an earth system justice perspective, where the most important story is recognizing the other, where it's important to have epistemic justice and data justice, and to connect ontologies and the coexistence of axiologies. What's really important is look at interspecies, intergenerational, and intragenerational justice, and we saw some of these narratives come up. Moreover, when you think in terms of procedural justice, you have the right to access information, but today misinformation is a big problem. Inclusive decision-making, civic space, which Laurence talked about, and courts, which Rafay talked about. So let's talk a little bit about the court story that Rafay brought up. Rafay made it very clear in his presentation that in Pakistan, there is a right to life, which is a very important principle used in law, and that has been connected to a right to health and environment. And I'd like to connect that to the story that we did in our presentation for the Lancet Planetary Health, where we said that the right to life and health implies that there should be no significant harm to people, which means that in climate change, we should be talking about 1 degree centigrade, not even 1.5, because already at 1 degree centigrade, about 100 million people are exposed to extreme harm. And at 1.5, you start seeing triggering points. So in some ways, we're linking the story of the principle that was adopted by the court. And of course, the courts come back and you have a policy in Pakistan, you have a law in Pakistan, and it's about not only creating a council, but a group that can operationalize the policy. But then that doesn't really happen in Pakistan. And so he brings up the storyline of the need to focus on how do we actually implement this. I'm going to stay with just this slide, but I had some slides prepared for you guys, but I probably didn't send them. When I was trying to show you that worldwide, more than 80% of people live in areas where we cross the air pollution boundary. So it's not just in Pakistan. It's also happened in the UK, and in London, there was a court case on the same issue. But it's across the world, the air pollution boundary is crossed. Across the world, we find that nitrates boundaries are not being followed, or biodiversity laws are not being followed. So the issue Rafay brings up, that is not just a developing country issue, but it is across the global world, that policies are not necessarily being implemented. And this makes it so important to listen to Laurence's story about mobilizing citizens and about countering misinformation and disinformation. And of course, in all this, when you try to actually operationalize the story that we have here in terms of justice, let me bring you to the bottom half of this slide, where we talk about two things: having just minimum access, so everyone should have access to minimum energy or minimum food or minimum water, and all of these have an environmental impact. So what would that mean in terms of the footprint on the environment? That is basically the bottom line, the foundation. And then we talk about the just no significant harm principle that will not affect the right to health and environment, which Ahmad was talking about, Rafay was talking about, which led us to the 1 degree centigrade boundary. So essentially you have a 1 degree centigrade boundary which limits your carbon footprint, and a part of that has to be reserved to meet the minimum needs of people worldwide, to food, water, energy, infrastructure, clothes, maybe a telephone, primary health care, primary education. And then there's very little left. And this basically means that we have to go to the right side at the bottom to address the drivers of climate change and inequality, address growth, unbridled profit and accumulation, etc., fight against fossil fuel lobbies. And this also requires us to think about liability for risks and harm. How do we allocate the remaining carbon budget and the responsibilities? Now, in allocating the remaining carbon budget, procurement is a very, very important instrument because it cuts across different countries. And I love the way Nick explained the various elements of his procurement strategy for hospitals and the fact that hospitals are a monopoly. But I'd like to inject into that also a sense of reality, because I've been working very closely with the Procurement Council in the Netherlands, and they were telling me, because they work with different companies, that in the first few years, these companies were very excited, and also their supply chain producers were very excited about moving along this net zero storyline. But as time passed, they realized it's very expensive, and many of them were claiming, I mean, I understand Nick made an exception for SMEs, sure, but then the problem is the large companies, they often use contracts. And this also came up in a number of storylines. And today what we find is that the Energy Charter Agreement that is in Europe prevents many of the European countries from closing down these fossil fuel companies, even if there's no demand, because there's a long-term contract which is intergovernmental and protected by the Energy Charter Agreement. And even though the European Union is trying to move out, there's a sunset clause which prohibits its early move out. And I see this problem with the Port of Amsterdam, because they're trying to work with all the different suppliers of fossil fuel into the Port of Amsterdam. And they say they're stuck because they have hundreds of contracts that they cannot easily break with foreign companies under international investment law or contract law, and so they're stuck. So while these are wonderful examples and very, very inspiring, there is a challenge in this story. And I think I'll just stop here with this explanation, except to say that for me, it is extremely important that we talk in terms of justice. And when Ahmad Rafay talked about the fact that there's not enough money for these governments to, say, reduce the pollution, it's not just in developing countries. I hear that also in rich countries. How are we going to get the SMEs to change? So there is going to be a financial problem. And this requires justice within rich countries and between rich and poor countries. And I believe there's enough money. I believe we could look at the debt of developing countries and try and use that for financing some of these things and canceling them. I believe that tax justice is a way also to raise money. So justice has to be central.
Thank you. Thank you, Rita, so much for that comprehensive reflection and on the presentations, and also for the way that you demonstrated it. That framework was incredibly useful. And that takes me to the next section of our session, the panel discussion. And the very first question I had for all of you was around exactly that, because several of you have demonstrated your efforts and the transformation that you led. However, as Rafay said, like, we do have policies on paper that are not enough, and Laurence highlighted that, or we have standards, but they are not enforced or like real authority. Similarly with targets that get adopted but not get implemented. Challenges are cost, time, and the question is really, where have you seen from your experience either legal or policy design that was able to overcome these implementation gaps? Whether at the government level, whether within healthcare, what is an example that made implementation possible? If anyone would like to come in.
Maybe I would like to first react to Joyeeta's comments, because of course, realism is really important. It's good to have good solution, and anyway, we have to play with the dynamic of societies. But at the same time, we are facing a lot of course, disinformation. Well, you brought all the elements, Joy. I cannot agree with you more. And so, of course, it's a lot of things to tackle. I do think finally, maybe if we have an entry point to all this, all the problem we have on disinformation, on shrinking civil society space, etc., this element of justice could be, in my view, it's the only one that can move society beyond this prisoner dilemma that nobody wants to do something because others are not doing. And justice, a sense of justice, and humans share, at least not maybe all of them, but majority of them share something about justice. And I think that could be a driver to put justice in the center of how we rethink the system. It's of course crucial. I totally agree with you. That's not the money that's lacking. Is a way that now the level of inequality has skyrocketed since the 20 last year, and even more in the last 10 years, even more even in the last 5 years. So it's just growing. No, it's just growing and growing, and that wasn't possible. And now we know that the 1%, whether they live in Paris, Bangkok, or New York, they are, of course, at the level, they have as a level, the same level of emission because of the way they're living and the way the money is used, where the 66% of the rest of the world population doesn't emit anything. They emit, the 1% emit as much as the 66% on the low end. So this, I don't think this, and again, when you add on to that the other living organisms that we have to live with, then the justice is, of course, even a broader concept. So again, I think we should not be frightened to think big, even if we cannot deliver everything but I think in a way, trying to build on the positive we see in societies, and I'm struck by what happened in Pakistan anyway, and I see what the local people are building their renewable energy system in a very decentralized way, which is really fascinating, what happened in Pakistan these days. So maybe building, it seems crazy to build from the bottom, but this time I don't believe so much on the top. So anyway, I cannot agree more with Joyeeta. So. And counseling debt should be, I think, very important, at least managing that in a way that at least a less developed country, we should counsel immediately. And no drama will happen if we counsel their debt, really, where they could survive.
Yes, thank you, Laurence. And this also answers the question, because it is so critical when we are designing policies and even legal mandates that equity is an integral part of both its design, but also the way that it should be implemented, and ensuring that the most vulnerable get to benefit and get to have at least their health, as Rafay was talking about, air pollution, is protected and considered within the acts that are being developed in Pakistan. But also decentralization and community engagement in policy design is also very critical, because then it gives ownership for communities to hold accountable for lack of implementation. I think the second question I had, which is also for the Commission, is how do you see the health community, the broader health community, whether clinicians, researchers, advocates, can most effectively contribute to the efforts that you are leading, whether within legal efforts or policy design or citizens' assembly? Like, what are the key entry points that would ensure health evidence, as well as the voices and the lived experience of physicians, are integrated and can also help support and make the case for your work?
I'd like to jump in, Omnia, and respond to that. There are air pollution sensors all over Pakistan. They're privately owned. They broadcast air pollution information real-time online, and you can access them with apps such as Air Quality, IQ Air, and things like that. And last October and November, we had AQI levels in Lahore in excess of 1,500. 1,500. Now, what we don't have in Pakistan is epidemiological studies that can give policymakers the data necessary, the information necessary to make, public health related decisions. All we have is high pollution numbers and some abstract that air pollution is bad for you. But we need these studies, and the Pakistani healthcare system isn't actually designed to accept. When you go into a Pakistani hospital, they're not going to ask you beyond your age and beyond your sex and beyond what you're presenting. Really, they're not going to document what the analysis is or what the treatment is. And so we have no information to be able to access. And these studies are necessary. I think training on especially in the health sector in developing countries on the ability to do these studies is very necessary. We don't have that in Pakistan. We have no epidemiological studies on air pollution in Pakistan.
But can I come in here? Because I think that, if I just look at my mother's house, we have an air purifier in the house, We have to clean the water. We have to do all kinds of expenses. So there is a whole business of creating air purifiers in the city of Delhi and most parts of India. So one could also look at these businesses that are coming up, which are not necessary. They're additional expenses for the citizen because we're not cleaning up the air. And that cleaning up the air could also lead us to phase out the fossil fuel. So in some ways, in developing countries, we could even say we don't need all that data because we know that the air is dirty. We know people live on the streets and the windows are open and it comes in. We know children play on the streets, and that is enough. And if the state doesn't want to take action, it should. The burden of proof should shift to the state to say, hey, what I'm doing is perfect and this is okay. Otherwise, Rafay, we will end up spending so much money in just monitoring and this epidemiological research when we actually do have enough evidence on this, in my view.
You're absolutely right. And my air pollution monitor is right there, by the way. That's the one I use in my office, and it's on right now. No, you're absolutely right. And the information about how bad air pollution is for you is available. But the way bureaucrats work with plausible deniability, they say, well, that study didn't happen in Pakistan. And so really, it's been one of the stumbling blocks in my sort of activism career to be able to convince people is that we don't have these health studies. We have data on how bad the air pollution is, and I can quote other studies about how bad it is every 10 AQI steps that you go up. But it's not, I need to be able to say, look, this is exactly what's happening to women and children in Pakistan.
Yes, thank you. This is very critical insight. So not only having the research, right, we always have the global figure of 7 million people dying because of air pollution, yet we need the contextualization of the research. And there's obviously a gap between the research done globally and in countries that are most impacted and how to engage researchers at the local level to generate the data that would convince policymakers to act. I'm curious, Nick, from your perspective, have you seen has the evidence on health really was a lever for example, the UK or in Singapore or Australia to have a net zero strategy for healthcare and to do that transition?
Look, I think at the macro level, over the last 30 years, the body of evidence that has built up from the health profession talking about the health impacts of climate change, the health co-benefits of mitigation, the sort of health system benefits of adaptation, that has created a space that has allowed the health profession to step in. It's made it okay, right? No longer do you hear from a Royal College, oh, we're not sure if this is our business. We're not quite sure if a health professional should be talking about climate change. I remember when genuinely sort of talking on behalf of a Royal College, I was warned, make sure you don't go on a panel with this environmental NGO because we're not sure that's a brand we want to be associated with. It wasn't that long ago, eh? So definitely the evidence was helpful there. But moving forward into the delivery and implementation side of things inside a healthcare system, no. The NHS is not decarbonizing. Singapore's healthcare system is not decarbonizing because it cares about the planet. It's doing that because it knows that it has to do that to respond to its patients' demands. It has to do that to be able to deliver good care. And if I'm really honest, all of these healthcare systems are doing the things that are low cost and saving them money. And those are the things that they're running at. They're doing this because you demonstrate it saves a little bit of money and they jump on it. So to that end, what does that? Well, passionate, angry health professionals. There isn't 1, 2, 3 solutions in a healthcare system. There are 7,000. Every single thing in an intensive care unit, in a nephrology ward, in an occupational therapist, clinic in someone's home, there are different interventions that you need to see. And for the most part, when I think we have seen change happen in a healthcare system, if you trace it back far enough, somewhere there was a nurse that said, God, does it really have to be this way? And just went on and changed it. And someone said, no, the regulation doesn't let you and the law won't let you and it costs too much. And they said, watch me.
Amazing. Yes. Thank you for that. And cost effectiveness, as you said, it is a key driver, both at the facility level, but also at the national level, right? We're looking into, that's what we try as a health community to look at co-benefits and to make economic arguments. But also, as you said, the power of healthcare professionals is so critical to really do that change within our workplace and within our community. But Laurence, over to you in terms of health evidence in your work.
I think there are extraordinary examples. The publication of air pollution data in Beijing by the US Embassy has made the total change in the Chinese policy. that has been the tipping point, really. Not because China didn't anticipate the green technology revolution, etc., but on that, it was because the citizen just wanted clean air, and that was not, even in a very authoritarian regime, they could not, but in a way, pay attention. The second one is something more local, but of course, I don't know exactly the price that could take in Pakistan to do that, but we have, with my foundation, we have provided small devices. And I have one good example in Poland where, of course, there was a lot of lobby for coal and etc. And this has changed totally when we could put this very small device, which was local, well, what you have in your office, Ahmad, but to the local schools, for example, or in the street, and then give the people the availability of information on the internet. And that has changed a lot, deeply. The feeling of the Polish population was very attached to coal, to something now cleaner, and now it's a solid thing. And I think, I don't remember the cost of the device, but it's a really small cost, and that could be something maybe WHO or others could subsidize in some countries. But it is, well, it has been super efficient to mobilize people, even in government. I look at Italy, for example, where the government is not in particular favorable to climate policy, but the fact that there are devices on air pollution on transport, in particular in cities, makes that the mayors that want to do something stronger than what the central government wanted, they could do because of that, these data. So again, it's much better when you could have really a national database, but at least to mobilize citizens, this is a way. But in China, it has been night and day. They tried to block the information, they could not, and then they have to, even now, well, it's just more or less now, it's more or less transparent information now.
Yeah. Completely agree. And I know also the city of Paris has been doing a lot of work as well around,
yes,
you know.
Yes, the school were very, even if, of course, there are always people shouting against that, really the improve of the air quality has been felt, no, even if it's still polluted, really, but still much better than others.
And that also reminds me of one of the, the examples we used in the UK where air pollution was recorded as a cause of death, and that was in 2009.
Yes, very impressive case, very impressive case, huh?
Exactly, for the first time, and it set a precedent of how air pollution is, especially for children. So yes, and I think the last question I have before I turn to the questions from the commissioners and the participants is, in a few sentences, if there is one, and you already shared a lot of the levers you are doing, but if that's it, or if there is a new legal or policy lever that you think holds the greatest untapped potential for climate and health transformation, what would it be and why?
A civil society vision of a sustainable future that's more durable than the 5-year election cycle.
That is so on point. Especially that.
I cannot say better, so I will repeat what Ahmad said.
Okay.
Maybe I'll go back to the advisory opinion of the International Court of Justice, because, in my view, and maybe I'm a biased legal scholar to the extent that I'm a legal scholar, the no significant harm principle was very important in water law. So in transboundary rivers, you're not allowed to cause harm to other countries. And this is a very important principle that was there in an air pollution case between the US and Canada, and it was there also in many, many documents. But in 1992, it was adopted in the Rio Convention, but not in the Climate Change Convention. And now the International Court of Justice has said that the no significant harm principle is important. We must not, all states, whether they ratify or not, have a responsibility to the environment and not to cause harm. And I think that is so important because it is in every culture, whether it is Islamic or Jewish or Hindu or Christian, we are not allowed to harm each other. And it's institutionalized in law, and then it was dumped. or ignored. And now it has been brought up back again. And I think this is going to be a massive new way. It's giving much more energy to all of us to fight to prevent harm to others and maybe to actually cause positive benefits to others. So not just say, I'm not causing harm, but actually I'm benefiting you through my supply chain, you know? So I think that's very exciting.
It is. I completely agree. And I think that takes me to the question Andy has asked, which is also related to, we've seen, as you mentioned, Joyeeta, the ICJ advisory opinion was led by the Pacific Island Students Alliance together with the government of Vanuatu. And it shows also a lot of the efforts that many young leaders and experts are advocating for intergenerational justice. And this is what Andy's asking about, if there's a role or if you know innovative legal approaches that recognize the rights of future generations to a healthy environment. And he shared the example of in Wales, they have a Future Generations Commission and a commissioner that reviews all the policies that are developed by the government of Wales to see whether it benefits or causes harm to future generations, and kind of check and make suggestions across all the sectors within government. So
I want to come back on this issue, because while I really am appreciative of this, I think you can't protect future generations alone. You have to do intra-generational equity as well. And I'll give you an example. 78% of the remaining fossil fuel is in the developing world. So it's not enough for us in the global north now, at this point, 25 years after, the convention was adopted, to say, okay, we're going to rapidly phase out fossil fuel, because for us, we've more or less finished our fossil fuel. But the developing countries are starting to use their fossil fuel, whether it's Africa or some of these other countries. So what's going to happen is, if you don't take into account intra-generational equity and interspecies equity, there's no way you're going to be protect future generations, because these three things are so interlinked. So while I appreciate this, that's why I was talking in my justice story, you need all three and you have to work on them simultaneously. And that basically means that in Wales, they have to also look at, what are we doing that is causing harm to the developing world? What are we not doing that is causing harm to the developing world? And how can we make sure that the developing world does not use fossil fuel for meeting basic needs? How do we help them make that leapfrogging? Otherwise, that you can't protect the future of Wales.
Yes, agreed. And this links to the broader just transition agenda, right? Like how, as we talk about mitigation and net zero and transition, how to enable developing countries to also be part of that transition in efforts to protect both the current people and also future generations. Anyone would like to comment on that?
Yes, I'd like to jump in. I haven't seen the Welsh legislation that Mr. Andrew Haynes has referred to, but as a representative here today of the Global South, I'd like to reflect on what a sort of rights of future legislation would mean. And I need to start by the immediacy of the climate crisis right now. I mean, we're in a sixth extinction event. The climate crisis, it's not going to happen, it's happening. I live in a country that's suffered floods in 2022, and there's an attribution study that says that 50% of the intensity of the rain that created a 100-kilometer lake in Pakistan was caused by the 1 degree centigrade of global warming that we've experienced. So that wasn't a natural occurrence that displaced 30 million people. That was a man-made occurrence brought by the greenhouse gases emitted by the global north historically. We suffer from this. And there was an attribution science published today that 15% of the intensity of the monsoon rains in Pakistan this summer are attributed again to the 1.1 degree centigrade global warming that we've experienced. Dozens of people have died. Homes have been swept away this summer on account of this. So we are suffering this. But at the same time, before I answer this, I need to also point out that climate change, although it's real, and a problem, is actually a symptom of our civilizational overconsumption of natural resources, driven by a capitalist world economy, colonialism, patriarchy, consumerism, and a fossil fuel economy. And unless you address those issues, you can't do anything about climate change. What an intergenerational legislation would mean is that citizens of the global north would have to change their habits. You folks would have to change the way you drive your cars, the way you electrify your homes, because my people are getting flooded. That's what it means to me.
Yes, thank you. And both Rafay and Joyeeta, you really echoed the importance of, we talk about intergenerational justice, but we also need to talk about, and that's what we see in the climate negotiations, for example, what developing countries are asking for is justice across nations and not being in that, being enabled to do that transition, to be able to not only, as we say, transition to net zero, but to be able to adapt and protect the health of our people that are being impacted the most. And that's in itself, yes.
Omnia, one other problem, of course, is that in Europe, we have about 21% of the European population living more or less in poverty. And in America also that is the case. What you see is the wealth in the global north. So our renewable energy subsidies go to people who can buy cars, solar panels, and heat exchange. They don't go to the single mother who doesn't have a job and has 3 kids to look after. So in Europe also, most of our subsidies go to the rich, not to the poor. And then when they complain, then they get a fossil fuel subsidy. And that is your $7 trillion of fossil fuel subsidy. So the way in which our policies are crafted are also creating inequality in the global north, which means that when I talk to people on the street, they don't want to help the global south because they say, I can't get off fossil fuel myself. And that is because their wealth is just going up, which is Laurence's point in the beginning, which he said we're seeing inequality grow every year in the global north and the global south. So it's now a rich-poor issue, more than a north-south. If we don't solve the justice in the global north, in the global south, because don't forget in Pakistan and India, we have massively rich people also. So if you don't solve that and then do the cross-border thing, we are not going to be able to get there.
Yeah, because this overconsumption pattern, of course, and I totally agree with Ahmad, is the long story of the development of capitalism in Europe and United States first. But at the same time, now the way out is, of course, to break with that pattern of modeling where I'm struck by the fact when just as an anecdote, when the COP28 took place in Dubai, I saw a number of colleagues from developing countries, negotiators for climate change, that were fascinated by what they were saying. And it is a splash of wealth. But why have this wealth? It's a very polluted, Dubai is a very polluted city, so you breathe very badly, really. I was ill, I have asthma, so I could not stay very long finally. But then what is a model we try to emulate in our societies is really important. And this problem that Joyeeta said, that the intra-country and between-country inequality is now an even more immense problem than it was, because now in a number of developing countries, the model, what to be rich in China, the richer people in China are much richer than in France or in US, because the inequality there is really skyrocketing. And so, but that is overconsumption. How we can change the views that we have to overconsume to live is something really terrible, because there is no solution, of course. Even a just solution would destroy everything in the planet. So it's a way how we have a sustainable life. And I think we should take the lead on developed countries, of course. And it's possible, we will not die from it. I think it would be okay.
Thank you, Laurence. And I think we're coming to the end of our panel discussion. But before we close, I would like to ask each one of you to just give one final recommendation for the Commission. That's the final one. One recommendation to push for either legal, regulatory, or policy action on climate and health.
If I may,
yeah.
The solutions to climate change are well documented. We know what the problem is, we know what the solutions are. What we need is a new moral framing of the problem. This is unacceptable. Our economies are upside down. The wrong people are making money. The subsidies are going to the wrong people. We need a moral backing to approach this, very importantly. We know the technicalities.
Thank you, Rafay. Yes, agreed. Who wants to go next?
Maybe I'll go next and follow up in what Rafay said. I think we have to explain to business that their supply chain is unbelievably vulnerable to the impacts of climate change. And they get supplies from all over the world. It's very, very complicated. Even if you want to make a doll, you have, I don't know how many, 100 suppliers all over the world giving you different parts. So it's, or if you're making medicine, you need that from different parts of the world. So if we can explain to the top of business that their supply chain is going to get messed up, and therefore it is in their interest to work towards a just world, because otherwise they can't address the supply chain problem. It's close to the story about intergenerational justice that you need. So I'd like to sort of say we need to get the rich people on board as well.
So yes, both government and corporate accountability.
Yes.
Well,
Let
maybe
me a little while ago, I was having a conversation with the chief executive of an unnamed Nordic pharmaceutical company that sells a little pen that you can inject into yourself, and it messes around with how hungry you are, rolling out all over the world, hey? And they were really excited to tell me, Nick, look at this pen. We've managed to make sure that this pen is reusable, and we think we can cut the emissions of the full cycle of everything we're doing here by 11%. With this new recyclable pen. What they didn't say is that the market for that pen was about 4 billion people, and that they would be getting 4 billion people to inject themselves with something like that once a week for the rest of their lives, potentially. The carbon emissions of anything, clinical pathways, healthcare systems are a really simple formula: activity, and intensity. And too often, I think, when we think about the interventions available to us, we think about reducing the intensity of the emission. That's good. Lowering the emissions intensity of a light, LED light's good. You still get light. You still need light. But I think in healthcare, too often we don't talk about whether or not we really need that activity, about whether or not, and this is me playing into the conversations I've been listening to, but playing it back into something far, far simpler and more humble, just what I'm used to in a clinical sense. Too many interventions are not best practice for our patients, not needed. I worry that we run the risk of halving the intensity of emissions from healthcare and tripling the activity. And there we've lost. So I'd focus on that.
Yeah, thank you. Thank you for bringing this thing, Nick. Laurence, you wanted to comment?
Briefly, because again, I agree with all what I've said. That's why maybe the moral compass is needed again. We lost it totally. I think the economic analysis, the way that the cost for the system of climate impact should be brought to the front again. It has disappeared. We talk about the cost of action, not the cost of inaction again. But then we need a moral compass, because I think people are now believing anything, and I think they feel frustrated, isolated in some societies, as not all of them, but at least what I'm seeing from Europe. And I think we need a moral compass, because people need values in life. And that's important, that the value of solidarity and helping each other, and the sense of community is something that holds societies together. And we cannot confront this problem if we are not together. And so, again, many things, technicalities, having the economies right, because we tend to ignore the cost is really immense now, and they are unaccounted mostly. And of course, the market incentive, as Nick said, is just to go further and do more, and not to do less and be so only the sustainability has disappeared from the consciousness. Anyway, the moral compass seems to me something to get the people involved because of their values.
Yes, thank you all so much. And we are all echoing the same key messages, which makes it very challenging for me to wrap up this incredible discussion, that we all learned so much from. And I think one of the key areas that we started with is around the role of civic engagement, civil-led policies, as well as transforming our communities from passive recipients to active participants. And that also brings in the importance of equity, inclusion, and justice in all the work that we do within the climate and health community and the climate and health interventions that we design, but also that tied perfectly into how we create policies that can devolve, that can go to not only the national and global level, but also to the city as well as the community level, while co-designing and engaging communities from the outset with a real bottom-up approach. The power of legislative tools and levers is what the health community has as well, but it's important for us to, when we design policies, we also design hand-in-hand the implementation, the financing for it to translate into action, but also keeping communities and people at the center when doing that. The facility level and the 4 areas that Nick articulated clearly when it comes to governance and having a timeline, a target we're all working towards, engaging different actors, but also looking simultaneously at both the demand and the supply side interventions, and keep starting this conversation and driving more countries to learn from one another, and having the powerful voice of healthcare professionals to push that systemic transformation. It is important, again, the justice narrative is so critical, climate justice, justice for health and health equity, also building on what is happening, the positive actions that are led both at the national but also at the community level, locally led research and action is so important for us to consider when designing the climate and health agenda and the interventions. And finally, really looking at the systematic beyond just climate and health, but looking at our societies, at the challenges of polarization, overconsumption, and that is further deepening that injustice. But at the same time, we have the policy and the legal levers to address all these different challenges and to change the system from within. So thank you so much. And now I'm going to give the floor over to Howard. And thank you again, the National Academy of Medicine, for having me.
Thank you very much. What a rich couple of days we've had. So I'm going to review the overall context of our meeting and then review the components of the discussions both yesterday and today. Recall that the how of system transformation has as our overall vision health-centered climate action. The idea that social and economic systems, not just the healthcare system, but all the bones of the body politic, from energy to transportation to urban form, agriculture, industry, can view the climate crisis through the lens of human health and well-being. And by doing that, move in a coordinated way toward decarbonization, health equity, and sustainability. So the overall goals of our work together are to identify structural levers, to identify enabling conditions, to highlight and learn from real-world successes, and to analyze complexity, the barriers, the trade-offs, the synergies, the tipping points, and identify strategies for successfully navigating that complexity. So at the workshop over the last 2 days, we focused on economic issues yesterday and on governance today. Yesterday's opening session focused on economic valuation. Judith Roden opened with the grim observation that economic systems function precisely as designed, making decisions without incorporating, without valuing climate and health. Liz Robinson built on that observation and highlighted some substantial challenges. The economics field, she told us, is somewhat fragmented, with environmental economics and health economics bringing different, largely non-overlapping perspectives. And key parts of the solution space, such as healthy aging and the impacts of heat on labor productivity, are routinely undervalued. Stefan Verdet addressed the valuation of climate action within the health sector, reminding us that climate action sits alongside and may be seen to compete with other values, such as health outcomes and cost control, something that we return to with Nick speaking today. Stefan described integrative decision-making that could yield cost-effective interventions toward climate-resilient, effective, and equitable health systems. We then heard from several panelists representing 3 different financial sectors: private capital, a foundation, and the African Development Bank, and they all described positive actions in their sectors. Several enabling conditions emerged in that discussion: blended financing arrangements to leverage diverse funding streams, common metrics of impact such as the IRIS Plus at the Global Impact Investing Network, trusted relationships, all are enabling conditions. We also heard about barriers: political instability, policy uncertainty, currency fluctuations, all undermining investor confidence and blocking investments from private sources. We heard about heterogeneity among countries and how no one-size-fits-all solution to investing exists. And we heard of opportunities: engaging the insurance industry and pension funds, which both undertake valuation on long time horizons, leaning into documenting the costs of inaction as a counterpoint to the cost of action, doubling down on natural capital accounting. The second session yesterday focused on mobilizing capital. We moved from valuing to mobilizing capital for climate health action. Tamer Rabi transitioned us from defining value to the question of operationalizing financing. He set the stage for the discussion, pointing to the profound underfunding of climate health initiatives, to the dysfunctionality of current funding mechanisms, and to the urgency of fixes. And he reprised the discussion in the first session by noting the World Bank's commitment to blending, to leveraging capital from governments and private sources. Martin Edlund reviewed the enormous impacts of climate on health, not only in financial terms, both in absolute dollars and in GDP reductions, but also in morbidity and mortality. Although climate financing has doubled in the last few years, topping $2 trillion in 2024, it needs to quadruple by 2030 to meet estimated need, and it needs to rebalance because so little goes to adaptation relative to mitigation. Climate health funding in particular is hard to quantify because of shortcomings in the way data are reported, but it pretty clearly falls short of what's needed. Martin returned to the theme of blended financing and called for coordinating and stacking country budgets, concessional loans, commercial investment, impact investment, and catalytic grants. He shared an inspiring case study, the scale-up of Wolbachia use to fight dengue in Indonesia, with engagement of government, regional development banks, the Indonesia Business Council, global philanthropies, bilateral donors, and multilateral donors. The panel included representatives of governments, philanthropy, impact investing, and African bond repo markets. Vera Songwe documented the severe underfunding of climate financing, the unbalanced global distribution of this financing, and the neglect of adaptation funding. She described the new collective quantified goal, NCQG, with its $1.3 trillion target, including the major role of private finance. Sarah Jane Ahmed described barriers governments face in mobilizing capital, such as high interest rates and too short repayment periods and the burden of debt servicing. Encouragingly, on the philanthropic side, Jessica Brown spoke of growing recognition of the need to support adaptation measures such as heat preparedness. Across the panel, we heard about a range of financial mechanisms, including parametric insurance, debt for climate swaps, and the use of IMF special drawing rights. And we heard of some further very instructive examples, including Zola, an energy firm that began in Tanzania, expanded to Rwanda, Cote d'Ivoire, Nigeria, and Ghana, that is transitioning now from selling products to selling energy as a service, making health facilities far more resilient. And the recent bid from the Philippine Energy and Health Departments together for rooftop grids for clinics. Several themes emerged across both economic sessions. First, the need for full benefit accounting, identifying health benefits, climate benefits, social benefits, and more, and monetizing them as a strategy for unlocking capital. Second, there was a focus on the value of nature, both its material and non-material benefits, perhaps using a natural capital approach as a way to value nature appropriately and take advantage of nature-based climate and health solutions. And third, the need to focus on the poorest of the poor in any financing discussion, those who are most vulnerable to the health impacts of climate change in all climate and health interventions. Well, then we went to sleep and we woke up, and today we focused on governance, policy, and legal tools. The first session today addressed governing. All speakers noted the need for adaptability and resilience exists not only in health systems, not only in individual sectors, but in governance processes themselves. We need adaptable, resilient governance. Dr. Araga described the Africa CDC Climate and Health Plan, which includes directly confronting climate change, including health and NDCs, building capacity in ministries, multi-sectoral coordination, international cooperation, and weaving climate change into national health policy. Minister Mohammed described the need to take back control of Colombia's public health system from a largely privatized system that she said is not fit for tackling the climate crisis. She also spoke of the need for coordination across agencies at the local level. Nuan Taraki described California's state-level Integrated Climate Adaptation and Resilience Program called ICARP, including the importance of an initial shared vision and principles, the focus on climate-vulnerable communities, and the importance of positioning the ICARP in the governor's office at the intersection of multiple agencies. The second session today focused on legal and policy levers. We heard three fascinating accounts. Laurence talked about the powerful example of citizen assemblies, not only in France, but also in Milan and Brussels, that can overcome polarization and prejudice and deliver effective policies well ahead of what governments can do. Rafay talked about the role of litigation in the Pakistan case by civil society as a lever for requiring protective climate policies. But he offered a caution that judicial decisions are only a first step, and implementation may lag, requiring continued vigilance and accountability. And Nick Watts described a turbocharged industry-specific transformation. That's the healthcare sector. He described systematic processes to move toward net zero with governance, engagement, demand-side interventions, and supply-side interventions. And importantly, he noted the catalytic role of what he called passionate, angry health professionals in driving that transformation. Well, several themes emerged across both of today's session. One is contextual, the very legitimacy of government at a time when that norm is threatened by populism, mistrust, disinformation, and conspiracy thinking, and powerful vested interests. In deliberating about governance, we need to assert the legitimate and necessary role of the public sector in advancing the common good. Next is the concept of adaptation and resilience as principles of governance. We need governance that learns, shifts, and adapts. There was deep discussion of the political process today, how to arrive at effective governing arrangements. All speakers advocated collaboration and its precursors, cultivating relationships, building trust, integrating the needs of multiple members of a coalition, looking for synergies. But Susanna and Ilana both reminded us that truly differing interests sometimes collide, that power dynamics very much operate, that power struggles are sometimes needed. Louis Akenji referred to what he called the corporate capture of climate change solutions. Those of us who advocate public health and equity need to be ready sometimes to put on boxing gloves, say with regard to fossil fuel lobbies. But this isn't an indiscriminate sweeping statement. We need a nuanced, strategic, well-informed approach to engaging private sector actors in governance. Ilana, for example, differentiated private equity firms from responsible middle-sized companies. Next theme is coordinating, not only across sectoral agencies, health, transportation, emergency response, economic development, and so on. That's a theme that's been, that has arisen throughout the entire work of our commission, but also across scales, coordinating from the local to the continental, to the national, to the state, to the local level. Nuan Taraki put this beautifully. People don't live in sectors, they live in communities. We talked about the need to build political support for government initiatives. We heard about the social participation that's a core part of the Belém action plan from Dr. Zhao. We talked about the need for active participation of civil society and for accountability to help maintain that political support. We talked about the overarching need for equity and justice, both procedural justice and substantive justice, and including interspecies, intergenerational, and intragenerational justice, as described by Joyeeta Gupta. We talked about the need for clear communication and framing. Nuantara spoke of the importance of a clearly articulated vision early in California's ICAR process. Ilana said, quote, "We need a narrative for the public." Rafay called for a civil society vision of a sustainable future. In all of these examples, we need to communicate clearly and lead with communication. One of the examples is the need for openly and honestly communicating trade-offs, one of the big challenges we face in advancing climate and health equity. And finally, as a government function, we need data to inform decision-making and drive policy. Rafay cited the need for local data, and Laurence pointed to the impact of public air pollution data from Beijing to Poland on shifting public opinion and driving action. This is a particularly vivid challenge in the US now, as one after another government statistical function has been shuttered and research has been devalued. Maybe the best place to close is to point to Rafay's passionate call for a new moral vision, centering health, equity, and sustainability to drive both economics and governance as we move toward climate and health action. Thank you very much.
Thank you so much, Howie. Sorry about that. Thank you so much, Howie, and really for that nuanced yet comprehensive synthesis of the sessions from the 3 days of this workshop. Your remarks really equip the Commission well as its members look ahead, and we prepare for what will be the third and final information gathering workshop of the NAM's initiative on transforming systems for climate and health. The topic of that workshop is Systems Transformation in Context, Unlocking Country-Driven Pathways for Health-Positive Climate Action, and it will likely occur in early December over 2 days. Specifically, the upcoming workshop will explore how transformative systems change for climate and health unfolds across diverse national and regional contexts. The goal is to surface the structural factors, policy environments, and actors that shape systems transformation pathways. The NAM team will share further details as soon as we're able. And before we conclude today, I would like to express my sincere thanks to everyone involved in this workshop, including the planning committee, the speakers, our commissioners, and participants. Your inspired contributions and really thoughtful questions are very much appreciated, and they'll help shape this work going forward. And I'd be remiss if I didn't thank my NAM colleagues, Noah, Victoria, Miranda, and Chris, who worked tirelessly behind the scenes to make this possible and run very smoothly. So with that, we will adjourn the workshop. We hope to see you for the next one in just a few short months. Until then, be well and thank you.